Okay, hello. This is my presentation, Challenges and Solutions for the EMP Classroom. Okay, my name is Mark Rebuck. Okay, this is not my room. This is a messy room virtual background feature. My room's very tidy, so please ignore the background. Okay, so first of all, a little introduction to me. I'm going to take away my face because it gets in the way. Okay, so video panel. Okay. Okay, so how did I get here? So just very quickly, so I work in Nagoya, in Meiji University, in the pharmacy, Yakugakubu, yeah, a school of pharmacy. Okay, so I came to Japan in the early 1990s, and I worked in a language school, and I worked in a hotel for 1 year in Shizuoka, and then I was on the JET program as a CIR in Kagawa until 1996 to 1999. Okay, and since 2001. I've worked in several universities in Aichi Prefecture. Okay, Aichi Prefecture is where Nagoya is located, including Nagoya University. Okay, in 2013, I started working here as a tenured teacher. Okay, so this is a little article about my journey to teaching pharmacy. If you're interested, it's in the language teacher. Okay, so when I entered here, I was like, what was my job? I'm teaching English to pharmacy students. What does that mean? Okay, so I was like, in Japanese, the word mosaku. I was like groping for what to do. Okay, and I actually wrote these 3 papers just as I was exploring my job and what to do and different things. Okay, and I will quote these papers, some of them, in this presentation. Okay, this one is in a major bulletin. Okay, and you'd have to send off to the library. It's not on the internet, unfortunately. These 2 are on the on JALT. If you put them in Google, you can find them on Google. Language Teacher. They're both JALT publications. Okay, so these are some of the challenges I encountered when I entered. Okay, some questions I had to ask. Okay, so what are the needs and wants of pharmacy students? And teacher expertise. How much do they have to know about medicine, pharmacy, all this? Okay, and lesson content. So how should I make my lessons? What should they be like? Okay, and language management. And I had for the first time I was teaching big classes. I have small classes, but also big ones. 70 people. So how do I make this into like interactive class? And the last one I will talk about is assessment. I'm going to go very quickly through this. Okay, this is a good thing about Zoom is you can pause and have a look at the slides in more depth if you want to. Okay, so first of all, what is ESP? So ESP is designed to meet specific needs of the learner. Okay, this book is pretty good. Keith Harding, English for Specific Purposes. Okay, and maybe the use of practical application of language overrides other aspects of language learning. Okay, these are different kinds of explanations of what ESP is. ESP is English for Specific Purposes. Okay, and English for ESP can be, there's many different genres or different kinds. Okay, you can probably have ESP teaching pilots, pilot English, or brick builders, or bricklayers, or something. I don't know. Any field you can have the specialized English for it. Okay, my field is probably English for medical purposes, EMP, and you can say English EFP, English for pharmacy. That's what I use. That's the acronym I use. That's the abbreviation I use. Okay, the initialism I use, EFP. Okay, so let's have a look. So different lessons. I teach many lessons, but I think you can have a little, there's like a continuum. So EGP is English for general purposes, and EMP is English for medical purpose. And I would say that the aim of EGP is very general. Okay, talking generally. Okay, if there is a topic, it is mainly used as a vehicle for language learning. Often you don't have a topic. Often it's like you're teaching a kind of function, like how to talk about hobbies or going to the post office. But if there is a topic, it's used as a vehicle for language learning. But EMP, on the other hand, content is king. And if there is explicit language learning, it is incidental and develops out of the topic. This is my view. And methodology. Okay, so skills and techniques. So the skills and techniques gained in English for general purposes. I taught this, for many years. Can be used in EMP. However, the need for knowledge transfer from the teacher to students and larger classes justifies more of the lesson time being lecture style. So some of my lessons are probably more lecture style, but they are not one way. They are interactive. Okay, I will talk about that later. Okay. Yeah. So the first of all, I want to talk about needs and wants of the pharmacy student. Needs and wants. Okay. So the question is, will Japanese students need English for occupational purposes when they start working as pharmacists? They're not working in Australia or England or America. They're working in Japan. And will they actually need to speak English when they start working in a hospital or in a community pharmacy? And I would say it's unlikely. They won't use it. Of course, we have the Olympics next year because of Corona, and number of foreigners are increasing. But there are many books about the handbooks for like teaching conversations in the pharmacy. Lots and lots of books like this. This is one, is pretty good. Eric Skier. And I have used this as a reference. But there are no, in the English, we have the national examinations for pharmacists. After 6 years, they do a 6-year course, they take the examination. There are no English questions. In a medical exam, there are English questions. If you're becoming a doctor, there are like case studies, but not in the Japanese, not in the pharmacy one. So in reality, I think it's unlikely that most students will need to speak English often. Of course, there will be people if they work in Tokyo, maybe in certain places. And also many foreigners speak Japanese. Many foreigners don't speak English. So it's not so simple. But anyway, is it worth spending 3 years learning this kind of conversation, patient-pharmacy dialogues, on the off chance an American tourist will come into your shop? I don't think so. So what's the point of learning English for pharmacists? Well, I think the most important one is to gain information. You're obtaining the most up-to-date information on medications and research. Okay, find out about different perspectives, and also to consolidate understanding. So if you do the same content in different languages, it really deepens your understanding. Okay, and this is talking about how important it is to be able to get the up-to-date information in English, because things are translated much later in Japanese. Okay. Also, you have sometimes you get a deeper understanding of medical terms used in Japanese. For example, this is if you don't speak Japanese, this is in katakana, adrenaline. So adrenaline. So you can understand, what does it mean? Yes, ad means maybe nearby. So prefix means nearby. Okay, and renal means kidney. So adrenaline is an INE is like a chemical substance. So it's a chemical substance released near the kidney. So it's a release from the adrenal gland, which is on top of the kidney. Again, epinephrine is another, it's what they use in America more than adrenaline. Again, epi is on, like epidemic, on the people, epinephrine. Yeah, so again, it's the same as adrenaline, on the kidney, a chemical from on the kidney, on top of the kidney. Yeah, the adrenal gland is on top of the kidney. Another one is sarcopenia. This is like wasting, muscle wasting, old age, or often from cancer, I suppose. Yeah. So sarco is muscle. Yeah, actually penia means poverty or not much. Like if you look at the word penury. Okay, sarco means muscle. So if you say that sarcoma, muscle, yeah, this kind of cancer. So if you explain this, it becomes clearer. And like a medicine, humira, this is a kind of biological medicine. Yeah, adalimumab, very difficult to say. Yeah, but if you teach them that mAb means monoclonal antibody. Okay, when you have a medicine with mAb, that's going to be monoclonal antibody. Okay, and also the future. No one knows the future. Maybe you will need English in the future. This pharmacist, she went to Cambodia, and I'm sure she uses English in Cambodia. Okay, and this is Professor Negishi. So I teach a course with these two teachers. We teach like an omnibus course, three teachers. So Professor Negishi telling the students what they do, why they do need English. So you're selling the course. Why do they need English? These are second-year students. And he writes down, he gives a little pep talk for like 20 minutes. Okay, so we do that in the beginning of the second-year course. Okay, so okay, this is an article. Anyway, I've just talked about here why they need English. I've talked about they need it, yeah, for speaking to patients, but that's not going to be a big thing. But I think more important is providing medical information, okay, and gaining information, getting information, okay, and also navigating articles for specialist courses. In their fourth year, they start reading English papers. So yeah, it's important for their academic and also their professional careers. Okay, and what do students want? Okay, I did a big survey and I found out, I did a nice little acronym. So FARM. So they want something that's practical. Yeah, will it be an immediate or future use? And do the lessons dovetail? Okay, with the widening. This is, I explain this in the paper. Please read that. Authentic. So in the lesson, they want authentic material. So I'm talking about using videos and radio, not textbooks. Students don't want to use a textbook much. Okay, relevant. So is it relevant to the needs, and motivational? Okay, so if you want to find out more, this is quite a good paper, even if I say so myself. Okay, so pharmacy students need more than conversations in the pharmacy. Okay, so rather than English lessons, I give pharmacy topics in English. Okay, so I want to, if you imagine a student misses a lesson on the liver, I do a lesson on the 2 lessons on the liver. And let's say a student has a cold and they miss a lesson. So what do I want them to say? Okay, I want them to think, not this one, oh no, I've missed an English lesson and the chance to learn some new words and practice talking English. I don't want them to think, they won't think that. I hope they think this, oh no, I've missed a chance to learn about the functions of the liver and how treatments of hepatitis C has been revolutionized by DAAs, direct acting antivirals. Okay, so maybe you don't understand this, but anyway, I want them to think about the content, not the language aspect. Okay, so how did I find out about what is relevant, what is important? Okay, so when I entered, I didn't know about pharmacy much. Okay, so I asked professors of course specialist subjects. Okay, so when I had lunch or something, and reading, I read lots of books. I really have read lots of books in Japanese and English about pharmacy. And looking at exam papers, when I was proctoring, I looked at what they were doing in other courses. Monitoring the media, I'll come on to that next. Okay, and also Kaigai Kenshu. So I accompanied students to America 3 times. I went to USC and Samford, not Stanford, Samford in Alabama. And I watched the pharmacy color. This is what they're doing in America. So I learned a lot from that. Okay, this is the email I got from one of the teachers about what 10 things I should be doing in my course. And I've actually chosen hypertension and I did infectious diseases, asthma, stuff like that. Okay. Okay, just monitoring the media, just very quickly. This is just, I'm doing this today. This morning I read about this. So in England, the morning after pill is available in pharmacies. You can get it without a prescription. And since 2015, under 16s can get the morning after pill. So if they have sex, unprotected sex, the next morning they can go to a pharmacy, they can get this without their parents' permission. This has been for a long time in England, for 5 years. And Japan is very conservative. And I saw this, so next year, maybe pharmacy, you'll be able to buy morning after pill next year. This is not, and I will put this in the lesson. Yeah, I'll definitely put this in the lesson. Okay, so this is what I talk about. And okay, Nobel Prize this year for the discovery of hepatitis C virus. Yeah, that will go in my lesson about hepatitis C. Okay, and maybe I'll put a little video of the award ceremony. Okay, so this is, you have to keep up to date as a teacher. Okay, next one, teacher knowledge. And okay, so how much do I have to know about the things? Okay, this is quite controversial. Okay, so can teachers cope with material that requires extra knowledge? Okay, well, this is what he says, Keith Harding. You don't need to be an expert, but you need to have an understanding of your subject area. I would say no. I would say a bit more. I think, how can you teach what you haven't made an effort to understand? I've made an effort to understand. I'm not an expert, but what I teach, I try to understand myself, so I know how students feel in the process of understanding. Okay, for example, this has happened about a month after I entered university. I'm using this book. Okay, I don't use it anymore, but I was using this, and the student came up to me after the lesson, and usually before I entered this university, I would be asked about language. How do you say I'm not hungry anymore in Japanese, for example, or how do you say this in English? I don't know. But she asked me, is acetaminophen an NSAID? Okay, so acetaminophen, in England we say paracetamol. Is it a non-steroidal anti-inflammatory drug? I didn't know. And this was in the article about the FDA news. Okay, paracetamol. Okay, and I didn't know. And I thought, okay, yeah, I have, it's my job to know about these things. Okay. So in my office, I always used to buy books about language, about grammar and stuff and linguistics. And now they're on the bottom shelf. I never look at books on language. And I think that reflects my priorities. So I used to write lots of notes about medicine on the old exam mark sheet cards. And this is what I read over the lockdown. All the books I've read or looked into, none of them about language, all about, well, this is about TB, this is about immunology. Oh yeah, also I'm talking about, this is between hope and fear, I think, yeah, immune system or something. Anyway, at the end of epidemics, I read lots about epidemics, but I didn't read anything about language. This is my office. These are the books I read or dipped into during the lockdown. Okay, and you can see that all my English books, most of them, are under here, and I never look. Okay, so I never look at those books. Okay, I'm not that I'm proud of, but I don't really look at books. Okay, so why did I invest so much time in doing this? Okay, in gaining knowledge. Okay, I don't think for me personally, I wanted to create great lessons, so I thought I had to learn about this topic. Okay. And also I was very grateful to the university for them employing me, because I was always on like 4-year contracts and stuff, and I was really tired of it. And I got a job, and I really felt grateful. I had to do my very best. Okay. And so I was also ready for a change of roles. You know, I never really wanted to be an English teacher. I just thought, just an English teacher. What do you do? I'm an English teacher. I would felt a slight inferiority complex. But now I feel a little bit more than an English teacher. I say I teach medical English. I know it's quite superficial, but that's how I feel. Okay. And I've always been interested in biology and health. I'm also interested in the environment, different things. But, you know, I did sports science at university. I did A-level biology. Okay. I've always been interested. Okay. And also it's very relevant to me because I was a patient in Japan for 2 years. You know, I had a brain operation. I've got like a chronic illness. I go to doctors often. I have a daughter with chromosomal abnormalities. So I learned about genetics and stuff. Okay, so I want to learn more. If I was employed by a, I don't know, mechanical engineering department, I just wouldn't have done this. I wouldn't have invested so much time. I'm just not interested in like physics and stuff. Or mechanics, yep. Okay, and also for me, teaching is a way to learn. So making a new lesson, you know, it could take 20 hours or something to make like a new lesson about, for example, about diabetes. What, maybe two lessons. Okay, doing all the reading and then putting the slides together. But I knew at the end I'd have this knowledge, and that's quite a reward for me. Okay, so yeah, this is what she says about learning. How important, you know, when you teach, how much you learn.
And it never quite happened because I ended up staying at Bristol University, as you said, for 11 years.
Did teaching anatomy enhance your understanding of the subject?
Oh my goodness, yeah. I mean, I think, you know, this is the same with teaching anything, isn't it? You have to learn it at a greater depth and a more detailed level in order to be able to teach it. And also, I think as soon as you start teaching, you realise where the gaps in your own understanding are. You start probing how well you know a subject, and you think, oh, actually, I thought I knew that and I didn't. And you start to go back to kind of foundation levels. I always think of it as a wall that you're building up, and you get to a certain level of knowledge, and then you think, oh, I better just go and test those bricks at the bottom and make sure they're as secure as I thought they were.
Okay, so yeah, for me, teaching is a way to learn. So that's one of my motivations. Oh, but of course, we have part-time teachers. I wouldn't expect a part-time teacher to invest so much time. Okay, I wouldn't expect that. Okay, talking about lesson content. Okay, so how can I make a lesson relevant, motivating, interesting? Okay, so a few points. This book I talked about before, has lots of dialogues. Okay, this kind of dialogue, I know many people use this in class, but this kind of dialogue, you know, you could practice this in a small class. This would be okay as a springboard for a lesson. But having just this as a lesson, I think it's a waste. Because you can talk about so many things. Like, what about nausea? Okay, what is nausea? What causes it? Okay, you talk about antiemetics. You know, what kind of drugs that like prevent nausea? How do they work? There's so much more you can do. Just having this kind of thing. You know, this is okay. It's a dialogue, and it teaches you phrases in English. Which I'm saying this is students like doing this, but to stop here is a waste, I think. Okay, and this is the book I inherited from a previous teacher when I entered the university, and I used it for 2 years. I really did my best to use it. And the texts are important. They're on good topics. Okay, blood pressure, atherosclerosis, it's hardening of the arteries, side effects of NSAIDs. Yeah, this is like aspirin and ibuprofen, this kind of thing. Aspirin, is that an NSAID or not? I can never find an answer. Okay, genetics. Okay, but it doesn't teach about the topic. Okay, also it's out of date. And this is a description of a new disease, SARS. This is SARS in 2002 and 3. Okay, and I've done this. I'm really grateful because I have done about SARS, infectious diseases, since 2013. I always teach students about SARS and MERS, also Ebola and stuff. But I had a lesson in end of December, just before this SARS-CoV-2, and students were amazed at how relevant my lesson was. They all knew about coronavirus and stuff, and okay, so I'm grateful for this book to introduce me to topics. But again, it showed me I didn't want this. This is a big point, yeah? The text, it talks about how to read texts. It's like strategies for reading. But I find students know how to read. So all these courses about how to read, students know how to read in Japanese. They don't need a whole course on how to read in English. Of course, skimming, scanning, all this context, it's important. You don't have to do that. You can do that on the job. Okay, I think it's a waste of time doing a whole course on how to read. You could teach about pharmacy in a pharmacy lesson. Okay, so you teach about SARS, you teach about what it does to the body, what it does, how it gets into the cells, ACE2 receptors. You teach about this. Okay, so also I inherited this book. Okay, this is a second edition. This book I use this because I teach this course with another teacher. So she didn't want to stop using it, so I'm using it. But this is good because you can just take 1 or 2 exercises from the book. So I use a 90-minute lesson. I might use this for 15 minutes. I have 8 lessons. I only use this in 4 lessons for 15 minutes. That's it. Okay, because if possible, I wouldn't want to use textbooks, but I have to use this one. Okay, and it's not bad at all. But it mainly introduces medical vocabulary and doesn't go into the substance of the topic. Yeah, it's a really good book, one of the best, I think. But again, it's not enough for what I want. Okay, by the way, I'm talking about how do you get to know about, just one more thing. Podcasts are really great for learning about medicine, science and stuff. And you can I use lots of podcast clips in my lessons, lots and lots. Okay, and also, yeah, of course, YouTube videos, online videos are great. You can learn so much from online resources as well as books. Okay, but podcasts are just incredible for me. Okay, so I was looking at banana. I like ripe bananas. By the way, ripe bananas are best for your immune system. And I was saying, oh, ripe. Okay, and I thought, okay, ripe. That's interesting. Okay, so I thought ripe could be a new acronym. So yeah, ripe. I think lessons have to be relevant. So relevant to. So I'm going to change this to. Maybe I change this to a pen. Okay. No, not a pen. I need to make it into a laser pointer. Okay, so relevant to the core courses. Okay. And interesting, of course, most important. Not interesting, students sleep. Popular media. I think you should incorporate media, popular media. Yeah. Podcast clips, YouTube videos, newspaper headlines. Okay. And entertaining, engaging. Okay. That's a nice acronym. Okay. I'm going to give you 3 examples of activities. I do 100 lessons. I just counted 100 lessons, all original. Okay. And all I've made myself. Okay. And I'm just going to show you 3 activities that I've done recently. They are fresh in my mind. Okay, and I'm going to run through very quickly because the first activity is, it takes 25 minutes. I'm going to run through it in maybe 7 minutes. So if you want to stop, just stop the video and have a look at the slide closer. I'm just going to give you a feel of what I do in an activity. Okay. So for example, this is from this book, and this is, you have to put the medical name together with the definition. Okay, so let's have a look at this one, number 4. Number 4 is a degenerative disease of the central nervous system that often impairs the patient's motor skills, speech, and other functions. This is Parkinson's disease. Okay, this is in the book. That's all you learn about Parkinson's. I don't think it's enough. Okay. So I'm going to talk about, this is, by the way, very important. Students, I do not read these slides. Students read these slides in turn. They have a mic. Okay, they have a mic. Even now, I'm using a mic. I think it's important. I tell them to wash their hands, and I disinfect the mic. Okay, but they use a mic. They pass it around. So a student reads 1 or 2 slides, and then they pass it around. Okay, I'll talk about that later. And this is the first year class. Okay, 60 students in this class. Mixed ability. I would say the average TOEIC is probably under 400. Okay, so this is a very low level class. This is what I do, and this works. Trust me. Okay, so I asked this question. Okay, so this who is a disease was named after him. Okay, what was the name of the disease? And if students have good eyes, they can see Parkinson, and maybe they will guess. Okay, so I would say it's called Parkinson's disease. And then I remind them of the word eponym. We've done this in a lesson before. So eponym is something named after a person. And in medicine, lots of eponyms. For example, loop of Henle, Bowman's capsule. This is in a nephron. Okay, also sandwich is an eponym. But I remind them, this is just a reminder from a previous lesson. Okay, and the next one, this is from this very, very good book. It's a really great book. I talk about Parkinson's disease. Okay, just the introduction. And here they have to choose which word is correct. Okay, so one student is reading this. Okay, it is usually this book is in the way. It usually affects those over 65 where prevalence or incidence is estimated at 1%. Now, this is quite prevalence, incidence. Which one? They have to choose the correct word. It's a little bit difficult, yeah. Because this will be prevalence, because prevalence, how many people in the population. Incidence, how many new cases in a certain. So if it was incidence, it would be like 100 people a year, for example. Okay, and so they have a look and they do this. Okay, this is what they do, and then they give them the answers, and we go through it together. Some of the new words. Okay, and then we talk about 2 symptoms. Yeah, so a symptom is key symptoms: weakness of a throat. Okay, and then they have to again guess. Swallowing may become difficult, and we talk about the Parkinson's mask. Yeah, quite like a vacant expression, facial expression called the Parkinson's mask. Okay, another key symptom is tremor at rest. Okay, so when you're resting, you have a tremor. Okay, and we go through this. Okay, remember the students are reading this. I'm not reading this. Students are reading this. I correct the students' pronunciation. And okay, and then we have a little quiz. So which 4 are not motor symptoms of PD? Yeah, Parkinson's disease. Okay, motor, non-motor. I give them the Japanese here, and they have to look here. Yeah, and clever students will know that this means kinesia. Kines. Yeah, this will mean movement. Okay, this will mean movement. They should know that. Well, they may know that. Okay, because they know the word kinetic energy. It's not they indoor energy, and they also they do a course called pharmacokinetics. Yeah, yakugaku dodai gaku. This is yakugaku dodai gaku. I think so. Okay, it's how drugs move around the body, how they're absorbed, how they're metabolized, distributed, excreted. Okay, pharmacokinetics. So pharmacokinetics. So this, and IA is a disease. It's a suffix. Okay, and gait is how you walk. Okay, so yeah, so we go over this. Okay, yeah, this is the gait. Okay, and then they have to do this, they have to pair the symptom with a definition. So this, I do lots about how words are made, medical words, and also etymology. But they should know A means not without. For example, asymptomatic, or anemia, sometimes AN. Yeah, so akinesia maybe sounds like no movement. And then this means like something abnormal, and hypo is too little. And then Brady is quick. Yeah, for example, bradytachia is a slow heart rate. Yeah, if you have like arrhythmia, for example. Okay, so decreased slowness. Okay, they have a look at that, and then they should be able to put this together. Okay, so lots of quizzes, hit them, to make it interesting. Okay, now ask this picture. Is this picture dyskinesia or dystonia? And tone is like muscle tone. So you should know there's something wrong with the muscle tone. Maybe there's like contraction. And very important prefix. Yeah, in this dysuria, dysphagia, this means difficulty in swallowing, dysplasia, when the cell doesn't grow correctly. This is like precancerous. Look at this kind of thing. Okay, dystonia, give a little explanation in Japanese just to consolidate. Okay, and then we go to a newspaper article, a little bit old. I often use very, very up-to-date one, but this is a pretty good one. So Parkinson's sufferers face regular discrimination. Okay, some students don't know discrimination. Of course, we explain, and I ask students who knows the meaning. Okay, why? Okay, why do they? And then we talk about, sometimes the movements that people think they're drunk or on drugs. Okay, this kind of thing. Okay. Then we get on a bit more difficult. What causes Parkinson's disease? And we talk about the brain, a little bit about the brain. I always give the Japanese, I'm not doing this, not anatomy class. Okay, but the main point is that in Parkinson's, the part of the brain that makes the neurons in one part of the brain die. Yeah. Okay, and that causes dopamine not to be released. Dopamine is very important for movement. Yeah, so we go through this slide. Okay, and well, of course, the student will read this, and I will go through it afterwards. Okay. Okay, and I also give the Japanese. This is the part of the brain, the substantia nigra, the kokushitsu, black body. Okay, and then we do. I like this gap fill. They have to choose a word. Okay, so if you want to try this, if you want to stop it, and you can try yourself. Okay, and we give the answers. Okay, I'm just going through very quick. Of course, this will take much longer in lesson, probably about 20 minutes, I said. Okay, okay, so we talk about neurotransmitter, very important word, neurotransmitter. Okay, between nerves, it goes over synapses, very important. And there's how many neurotransmitters? Japanese people hate to guess. Japanese students, generally, they never put their hand up. But I find if you give them this kind of expression, it makes it much easier for them. I'll take a guess. So how many neurotransmitters are there in the body? Okay, they have a little guess. I have no idea, but okay. Okay, and we go through that. Okay, over 100, but actually 7 do the majority of the work. And we talk about dopamine. Then I go over the dopamine, different functions. One important one is pleasurable reward. And that's why people do, one of the reasons why people get addicted to games. Like my son, this is my son playing a game, and I can't stop him because he's addicted. He gets a dopamine, trigger. He gets dopamine being pumped out of the nerves. Okay, okay, this is again in Japanese to consolidate. Okay, and I watched the following video about PD. Jot down 3 or more facts that you have learned from the video. Okay, so I give lots of videos in my class. Okay, and okay, so let's just have a look. This is the kind of video.
Hi, I'm Dr. Rachel Dolan, Vice President.
Okay, I show them the whole video, and they have to write down a few things they've learned from the video. Okay, I'll just show you.
And there's no standard trajectory or path. So if everyone gets their own version of Parkinson's, then what does everyone with PD have in common? To answer that, let's take a look inside the brain. In Parkinson's, the brain cells that make dopamine stop working or die. Dopamine is a signaling chemical, or a neurotransmitter, that coordinates movement as well as feelings of motivation and reward. When dopamine cells die, Parkinson's symptoms emerge. Exactly why these cells die is not well understood. Researchers believe that
Okay, so I bring in the voice of experts. Okay, so I bring in lots of people. I can't invite them, but I bring them in videos and huge and clips from podcasts, for example. Okay, and this is a little mini dialogue. Okay, so this is talking about levodopa. This is a very important medicine that is used in treatment of it's a first-line treatment in Parkinson's disease. Okay, so if you want to read this yourself, but this is between the doctor and the patient. We're talking about. I'm not going to go into in too much detail. If you're interested, please look at this. And of course, students. This will be between students or between me and one student. Okay, I'll be a doctor and patient or patient doctor. Okay. And then we have a little quiz. Okay, this is going to be a bit too much detail, so I won't talk about this too much. But I'm just trying to, I had to understand. It took me time to understand this. So I'm just going through the process that I did to understand, so students can understand this. This is what they will be doing probably in the third year. So they still have another, maybe in the second year, but they will not be doing this in Japanese in the first year. They're doing it in English first. Okay. And then, we talk about this. This is an enzyme. Okay. And then we have another dialogue in the pharmacy. Okay. And when you give levodopa, it's often given with carbidopa. So I talk about why is it given with this medicine. Okay. And then we have this one is more like filling in with one of these words. Okay. With like a conjunction word. Okay. Yeah. Adverbial conjunction maybe. Okay. So therefore this kind of thing. Okay. And they have to look at the context. It's quite difficult, but they do. I give them some time to do this. One of them is reading it, and the class helps them to fill in the words. Okay, and this is what we have. You want to read this? Okay, if you're interested, if you're teaching this, this makes it quite clear why. Okay, and then I show this little diagram, and we have another. I'm really trying to bang in why it's given with carbidopa, like a true and false. Actually, the questions are very easy. Very, very easy. Okay. If you understand the concept, okay. Okay, and I give the answers. Okay, and I give another one. And this one I want to focus on this word catalyze. Okay, or catalyst. Catalyze is a verb. And we talk about the word catalyze, means, shokubai in Japanese. But the word catalyst, I give a definition. And then this lyse, this means to break down or pull apart, untie. And lyse or lysis is used in many, many, many words. It's a suffix, very useful suffix. Dialysis, hemolysis. Okay, if you get bitten by a snake, some snake bites, some snake toxins, venom, they cause the red blood cells to break down. This is called hemolysis. Analysis, you're pulling information apart. Yeah, and this, kata. What does kata mean? I talk about this means like down, like cataract. Or catabolism. Yeah, this is like kind of metabolism where you're breaking things down. Anabolism, anabolic means to build up. Anabolic steroids, for example. So catabolic is to take down. Okay, break down. Metabolism is breaking up and building up both. Okay, and I give them this Japanese, okay, to consolidate. Okay, and we talk about the word prodrug, a little bit difficult, but prodrug is something which is not active when you take into the body, but it becomes active after some kind of reaction in the body. Okay, and I give the Japanese, of course. It's a little bit difficult, so I give the Japanese. Okay, and I talk about this movie, Awakenings. Okay, this is all about levodopa. And this is Sachs. What's his first name? I've got this is based on like Jonathan Sachs. Anyway, he died a few years ago. I've got his biography. Very interesting guy from England, Jewish guy. He went to America. Anyway, but this is about how he helped people with levodopa. Amazing movie. Okay, I show them a clip. I won't do that now. I do show them a little clip. Okay, and then I ask. We come to the end of this section. Okay, who is this actor? And some of them know Michael J. Fox. Yeah, Back to the Future. And then I show them a video, and I ask a question. So, which activity of daily living does Michael J. Fox find difficult? Okay, activity of daily living. Yeah, what you need to have to look after yourself, washing, feeding, going to the toilet. Okay, and I ask that. Okay, activities of daily living. Okay, and I show this video. Okay, I'll just show a little bit.
Back to the Future was a film that helped define the 1980s and made Michael J. Fox a star. More hit movies followed, as did a string of awards for his TV series like Spin City. Now, though, his future's increasingly defined by Parkinson's disease.
As soon as I wake up, I can't go back to sleep. I mean, it starts going. So I would say that's the toughest part in the morning is to kind of go, well, I'm up whether I like it or not, I'm up now. And the other thing that happens to me in the morning, first thing is I get that dystonia, which is kind of cramping, and it can be very extreme.
Okay, that kind of, yeah, and so he finds brushing his teeth difficult. Okay, and last one is I talk about tremor. Okay, example of a motor symptom. But there's also a sensory system. Yeah, sensory system. Kankaku shoujo, which is a more common symptom than tremor. And they have to choose which one do they think is more common than tremor, which sensory symptom. Okay, and they have a look at these ones. Okay, of course I explain the meaning of the word blurred, my disturbance, my sumin shogai. I often do it in Japanese. It's quicker. Okay, and yeah, so this one, actually, these are not sensory symptoms. So you have blurred vision, hearing, actually loss of smell. Okay, and sorry, I actually played this before.
No. I think that most people that get Parkinson's disease have some degree of smell loss. So at the point of diagnosis, maybe 70% have lost their sense of smell. And later on in the disease, that figure's more like 90%. Okay, that's listening. Yeah, they have to listen. And you can catch the word smell. It's not so difficult. Okay, loss of smell. Okay, so 70% on diagnosis have loss of smell. This is from this program. This is on the BBC. Okay, and also I talk about a little bit. Dia means through, diabetes, diarrhea, diagnosis. Gnosis means to know. Yeah, so agnostic means not knowing. Prognosis, to know into the future. I remember this is that we've done this before. I remind them. Okay, so also we talk about COVID. Yeah, with COVID, loss of smell is a very important symptom. Okay, very quickly, we're going to two more, very not so long. This one, these are shorter. We talk about kidney stones. Okay, they have a definition: concretion, solid concretions of dissolved minerals in urine, kidney stones. I talk about hyperuricemia. I have a little talk about. I just want to go into how you can make a lesson. Okay, I like to talk about how patients feel. Okay, so this is the kind of art. This is the kind of activity I would do. That you have an interviewer. Okay, and you'd have a person being interviewed. So interviewer, I'd like to ask you about your experience of kidney stones. What happened? Okay, and this is Lorna Brown. She talks. Well, it was 7 years ago, and I was on my holiday in France. So France, it could be Euro Disney. Okay, with my husband, wife. Which one? Wife or husband? Laura is a woman, so it would be husband. Of course, we have same-sex marriage in English, so it could be wife. I explain that to students. That it could be wife, but let's say husband. Okay. And we were in the bath or bed asleep. Where do you sleep? You sleep in the bed usually. Okay, so students, we have a student doing that. Okay, one slide each. Okay, they pass the slide around and they have to guess which one. Okay, and it is far worse than childbirth. Okay, but for students it's quite difficult. I had a child and it was far worse than going to the dentist, some students will say. Okay, and I was on my hands and knees on the ceiling. I showed them the picture of Spider-Man. No, it's on the floor. Okay, and then we have this, and you can see how I made this exercise from a podcast.
Actually, control the pain. And sometimes I have had patients have said it's worse than childbirth. Actually.
My name's Lorna Brown, and it was about 7 years ago. I was on holiday at Euro Disney in France with my husband and my son. We were all in bed asleep, and I suddenly woke up about 2 o'clock in the morning with intense pain, the worst pain I'd ever known. I was pouring in sweat. I had no idea what was wrong with me, even though I'm a nurse.
And where was the pain?
The pain was in my back and my lower abdomen. I always liken it to the fact that I've had a child, and it was far worse than childbirth. It was the worst pain I'd ever experienced.
You're a nurse. What did you think was going wrong?
I had no idea what it was at that point. I tried getting in and out of hot baths. Everyone else was still asleep in the hotel. I tried painkillers, I tried everything, and the pain got worse. I couldn't get away from it. I was on my hands and knees on the floor.
Okay, so you're giving the patient's feeling. It brings everything to life. Also this one, I want to bring terminology to life. So, for example, polypharmacy. Okay, so polypharmacy, students know this, is taking many medicines. This is my father. He died in August, but he was taking many different medicines. Okay, and we talk about polypharmacy. So which word goes in both gaps? Yeah, poly means many. Yeah, polyuria, polyneuritis. Okay, these are words they should know. Okay, okay, so polypharmacy is taken. They have to try and guess which word. Same word goes in both gaps. And it's more common among elderly people because they are more likely to have 99 chronic diseases. Okay, and yeah, the word is multiple. Could be several. Several is okay. Okay, and I give them this. Polypharmacy is now used as a katakana word. Okay, so polypharmacy mostly affects elderly people, but it's also increasingly common in young people with lifestyle diseases. Okay, so this is the last video I will show. How many kinds of medication does this 30-year-old woman take? This is from a BBC documentary. Okay, old before my time. Okay, so they have to watch this. How many different, okay, so it's here. Okay, 3. Okay, so I go through what kind of, she takes 7 kinds of medication. Okay, I just go through acid reflux. Okay, for depression, for asthma control, 2 kinds, including a steroid. Yep. I don't go into the names. Okay, and also a drug to protect her bones, and also gout medication. Yeah, times 2. We just go through. This is an example of polypharmacy. Okay, so just looking at a student's comment. So students say, that many are, you get a few saying, why do you use so much Japanese in class? Very few. Most say, yeah, they are happy that I'm explaining. Yeah, I'm explaining in both English and Japanese. So they can understand the content. So yeah, you're doing the content both in English and Japanese. So they come away with understanding. Okay, so I get many of these comments saying they're grateful for English and Japanese. So for me, understanding content is paramount. So I reinforce understanding by using Japanese in class and also on my PowerPoint slides. This is a comment I get also sometimes. We're learning in English stuff we haven't even studied in Japanese yet. And I tell them, for me, the first book I read about pharmacy was in Japanese. Okay, and also there's no rule saying you have to learn something first in one language or the other. And also if you learn in English, if you put the effort in learning in English, when it comes to Japanese, learning in Japanese, you'll have a foundation. Okay, so I tell them, yeah, don't worry about which order you learn things in. Okay, I want to go on to class management very, very quickly. So for me, the one point is using the mic. So of course I have to now disinfect it. Okay, but class management. So if you want to make a big class, if you have a mic, it transforms my lessons. Once I can pass a mic around. So each student is responsible for 1 or 2 slides, okay, and then passes it to the next student. Okay, this cuts teacher talking time. Also makes teacher and students interactive because students are talking to me, I'm correcting them. It saves my voice. Okay, it allows monitoring and correction. I can monitor and correct students. Okay, and also it keeps students on their toes because the mic will come to them at some point. Okay, and last point is assessment. Okay, so I want to do assessment rated to 5 minutes. Okay, I want to do this in 5 minutes. Okay, so what do we cover for the test? So I usually I can give, for example, PowerPoint slides, like a handout of my key points from the PowerPoint slides. I do that sometimes, but more usually I give an extract from a medical or pharmacy book about a topic we have done. I used to say, read this, the exam will be based on, so I give like 2 pages or 3 pages about diabetes. Read this, the exam will be based on this. And so many students failed. Then I started, okay, they need more help. So read this and answer I gave them questions. The questions were written questions. The exam will include some of these questions, but in a different form. So all my exams are multiple choice, mark card questions. Okay, so I give them, and I say some of these questions, and you get more students passing. But now what I tend to do, I tend to give lots and lots of multiple choice questions. And I say half of these or some of these will be an exam, will be. So work through all these and you will pass, okay? Or this is what I've done very recently is giving videos. So if you watch these 2 videos and you answer the questions on the videos, you will answer, but they're not easy. These are 2-hour videos, yeah? And half of these questions will be an exam. So basically I'm giving difficult tasks for the exam, but I'm trying to make difficult readings for the exam, but I'm making the tasks easier. Okay, so I don't want to fail. I don't have to fail a certain percentage of students. That's not my aim, but I cannot give a pass on a plate. I want them to work for their pass. So giving students the exam questions beforehand persuades students. So some would have given up without trying, but even those students now, they say, okay, I'll make an effort to read this and answer the questions. So the carrot is a pass or good mark in the exam. But most important is a process of reading, answering the questions. And when they finish the exam, wow, they've learned about this topic. That's most important. Okay, and this is the kind of readings I do. Antibiotic resistance or antihistamines, this kind of reading I have done. Okay, for example, this is, I say this to a daunted first-year student. Many first-year students, how can I read this? This is what I give to them. I say, it's not how difficult the text is, it's what you have to do with it. So if you had to translate this into Japanese, wow, that would be so difficult. Translating the whole text into Japanese, that would take a whole semester. Or if I say, okay, make an paper airplane, that's what you have to do for the exam. That's no problem, making an airplane from this from this handout. But I give something in the middle. They have to answer questions. Okay, this kind of question. If you want to read this, you can have a look. So many of these questions appear in a different form in the final exam. That's one way I do it, based on the reading text. Or recently I've done the video. If you want to read this is what I've done for the Zoom videos. The exams will be based on this. Okay, and this is the kind of questions I give on the videos. Okay, so just talking about exams, this is a university entrance exam. I think most native speakers, educated native speakers, will be able to pass the new sheet. I think most, or not pass, get 100%. Okay, but in my exams for my courses, being a native speaker is not enough to get 100%. So I think have a look at these. Most of these you can answer just being as a lay person. But some of my questions you will not be able to answer without specific knowledge. Okay, so if you want to have a look, you can have a look at these. Okay, this is for a first year exam about NSAIDs. Okay, this is again about NSAIDs. It's a first year course. I do like 3 or 4 lessons. So in the exam, there's lots about NSAIDs. Okay. This one, you could probably do just from your knowledge of English. This second one, Okay, so let's have a look. This summary. So I'm going to encapsulate what I've talked about. So one, content is king. So for example, in a lesson on diabetes, I do not use a topic as a vehicle for language use. For me, the topic is king. Okay, my priority is to teach them about diabetes. Okay. I use Japanese. I think using Japanese is necessary for the level of teaching students. If I teach in a graduate school, I teach doctors sometimes. I don't use Japanese so much, very little, okay? But now they need it as a reinforcement, as a safety net. So all students come away understanding the key points. Not all, some students do sleep, okay, but almost all students come away with all the key points. And if content is king, then I should know in depth about the content. I think that's my job to know that. And then reading texts for exams, I think they can be level inappropriate. I'm giving really difficult medical school texts to first year students who can hardly, really, they can't write a sentence in English. So I know it's inappropriate. I'm not stupid. But if you make the task, if you make concessions, for example, if you give exam questions beforehand, you can make them do work at difficult texts. You can make them do difficult things that they can't believe they've done. Okay, that's my presentation. I'm looking forward to any questions or comments you may have. Okay, so thank you very much.